Classification of bones. Classification of bones according to their shape. Here you can see this one, long bone. Long bone has some conditions like it has elongated cylindrical shaft and two ends. Elongated cylindrical shaft, that is also known as diaphysis, and two ends, they are known as epiphysis. Two expanded end, they has, you can say, smooth articular surface. What is the meaning of articular surface? That is the surfaces of ends used for formation of joint, that is known as articular surface. Each long bone has, you can say, cylindrical elongated part, that is also known as diaphysis. This diaphysis of long bone has three borders and three surfaces. Here you can see. Each diaphysis of long bone has one nutrient foramen. Nutrient foramen, that is very important for knowing of growing end. Always they are opposite to each other. According to shape, classification of bones has different variety of bones. Number one, that is a typical long bone. These all are, you can see here, this one, femur, humerus, radius, ulna, tibia and fibula. These all bones are, you can say, typical long bone. Why they are known as typical long bone? Because each has two epiphyses, one diaphysis with three border and three surfaces, including nutrient foramen. Subtype of long bone in second one, that is you can say miniature short long bone. Miniature or short long bone. As for example, they are metacarpals, metatarsals and phalanges of hand and foot. This miniature short bone has only one epiphysis. Remember that long bone has two epiphyses, but miniature long bone has only one epiphysis. Third subtype of, you can say, long bone, that is modified long bone. In this modified long bone, here you can see two ends, one shaft, but here there is some modification. Normally long bone has elongated shaft, okay, but here you can see clavicle has with curvature, shaft with curvature. In this modified long bone, maximally there is no medullary cavity. Typical long bone has, you can say, medullary cavity well defined, but modified long bone has no medullary cavity. Another type of bone, that is according to their shape, they are short bone category. Short bone, in short bone, best examples they are, you can see here, these ones, carpals. Carpal bone are arranged at the level of, you can say, wrist joint. Their name according to their shape. Their name given according to their shape. So these are, you can see here, carpal bones. They are short bones. Another example of, you can say, short bone, they are tarsal bones. Tarsal bone, they arrange at the level of, you can say, ankle joint. According to their shape, they given their name. Here you can see this one talus, this one calcaneum, cuneiform. Okay, so these are, you can say, carpals and these are tarsals. They are short variety of bones. Third variety of bone, they are, you can say, flattened variety of bone. What is flattened variety of bone? So they are like a plates. Here you can see these are flat bones. They are like a plates with only two surfaces. What is the importance of flattened variety of bone in our body? So mostly they are important for formation of certain cavities for protection of vital organs. As for example, bone of cranial vault. What is cranial vault? Cranial vault, that is a upper, you can say, flattened bone of, you can say, skull. Here you can see this one, cranial vault. This cranial vault, that is completely made up of, you can say, flattened variety of bone, and this is responsible for covering of, you can say, brain box. Here protection of brain occurs. Second important cavity, that is you can say thoracic cage. This thoracic cage that is made up of two flattened bone, that is number 1 sternum, that is also category of flattened bone, and here you can see ribs, they forming a rib cage. This rib cage or you can say thoracic cavity that is important for protection of lung and heart. Here you can see this one flattened bone anteriorly situated, that is known as sternum, and side wall of the thoracic cage that is made up of you can say ribs. Both are flattened variety of bone and important bone for formation of thoracic cage that causes protection of here lung and heart. Here another also flattened bone present in our body, that is known as scapula. Scapula, that is you can say flattened triangular bone of upper limb. Here there is a location of scapula, that is posterolateral angle of the skeleton that is made up of scapula. Okay. Another category of you can say classification according to their shape, they are irregular variety of bone. Irregular variety of bone, that means there is no particular shape of that particular bone. As for example, here you can see this one known as base of skull. Normally anatomical position of the skull is like this, but base of skull, that is a completely irregular bone. Importantly, in base of skull there is a sphenoidal bone, that is also known as best example for you can say irregular variety of bone. Another example of irregular bone, that is a hip bone. This hip bone, that is a bone of lower limb, and others are you can say irregular variety of vertebrae. Here you can see this one thoracic vertebra, that is irregular in shape. Here you can see this one lumbar vertebrae, that is also irregular in shape because of it has different projections. Here you can see this one known as vertebral body, but mostly this part that is known as irregular variety of bone. This one cervical vertebrae, process part, that is known as irregular variety of bone. So these are best example of irregular bones. Another category of bone, they are known as pneumatic bone. Pneuma means air. They are certain irregular variety of bone which has you can say air contents. Here you can see air spaces are present in certain bones. Here you can see, so these are known as no doubt irregular bone but pneumatic variety of bone because of presence of air. Pneumatic bone. So what is importance of pneumatic bone? No doubt they are irregular variety of bone, but in certain bone surrounding the nasal cavity, they are air filled bones. Why they are present? So there are three important functions of pneumatic bones. Number 1, because of presence of this pneumatic bone, the skull weighs very light. Second function, the second function, that is they are present surrounding the nasal cavity, and because of that they are also important for resonance of voice. They also act as a air conditioning chamber. Here you can see pneumatic bone has air chambers or you can say air filling bone. Because of that, whenever inspired air that is very hot, so they causes you can say coldness in the inspired air. Three main function of pneumatic bone. Once again, in short, they are you can say lightening of skull, means ke weight reduction of the skull because of presence of air. Number 2, they are responsible for you can say changes in the voice of different individual because of resonance of voice surrounding the nasal cavity. They are present, resonance of voice. And third function, that is very important function, they causes you can say coolness of you can say inspired air, air conditioning function. Where pneumatic bones are present, here you can see this one maxilla bone. Under cover of it there is a air filled cavity present known as maxillary air sinus. Here you can see this one frontal bone, air filled gap that is present in frontal bone. So this one known as frontal air sinus. Here you can see there is a, you can say, ethmoidal variety of sinuses. From front you can see here also the ethmoidal variety of, you can say, sinuses, the ethmoidal air sinus. In another skull you can see here ethmoidal air sinus. Another category of, you can say, bone, they are sesamoid variety of bone. What is sesamoid variety of bone? So they are, you can say, bony nodules, hard nodules present in certain part of the body. Their development occurs under cover of the joint, or you can say under cover of the tendon. Here you can see sesamoid variety of bone. What is the difference between normal bone and sesamoid bone? So here you can see sesamoid bone has no periosteum. What is periosteum? Periosteum, peri means surrounding, osteum means bone. So there is no covering of, you can say, bone present in sesamoid bone. Normal bone has, here you can see periosteum present, but here there is no periosteum. At the level of joint, sesamoid bones are related with, you can say, articular and non-articular surfaces. Here you can see this one rough surface, that is non-articular, but here you can see that is a smooth surface, that is known as articular surface. This one best example of sesamoid bone, that is patella. Patella develop under cover of the knee joint capsule. So this one non-articular surface, and here you can see this one articular surface of patella. Here you can see this one non-articular surface and this one articular surface. Articular surface, that is smooth in structure. And what is the meaning of articular? Articular means joint. Surface used for joint formation, that is known as articular surface. And this smooth articular surface, that is covered with hyaline cartilage, and it is lubricated by synovial fluid. Example of, you can say, sesamoid bone. This one largest sesamoid bone of the body, that is patella bone. Patella bone develop under cover of, you can say, knee joint capsule. Patella bone that is developed under cover of the quadriceps femoris tendons. This quadriceps femoris tendon, they inserted over the patella and causes development of patella sesamoid bone. Second, you can see here, second bone of, you can say, sesamoid in the upper limb, that is one of the carpal bone, pisiform bone. Location or surface marking of pisiform bone in the palm, that is this angle, that is according to anatomical position, superior medial angle of the palm. Here you can see this one pisiform bone. This pisiform bone develop under cover of the muscular tendon, that is flexor carpi ulnaris. Another example of, you can say, sesamoid bone, that is a flabella. Flabella bone, that is situated posteriorly under cover of, you can say, lateral head of gastrocnemius, that is at upper and posterior part of the fibula. Once again, sesamoid bone, best example, that is patella at the level of knee joint capsule under cover of quadriceps femoris muscle. Another example, that is a pisiform bone under cover of flexor carpi ulnaris at the level of wrist joint. Another example, that is a fibula bone. Fibula bone, that is situated, that is under cover of lateral head of gastrocnemius behind the fibula bone. And other bones, that is rider's bone, also develop in regular, you can say, riders. They are known as rider's bone. They develop under cover of medial side of the thigh, that is under cover of adductor longus muscle. What is the function of sesamoid bone? So sesamoid bone, they are important for resistance of the body pressure. First of all, so here you can see patella bone that causes resist of pressure at the level of knee joint. Here you can see this one pisiform bone, fibula bone. They all are important for resistance of the pressure. Second function of the sesamoid bone, that is minimization of friction at the level of joint. Here you can see patella bone that develop under cover of quadricep muscle and that causes minimization of friction at the level of knee joint. Here you can see pisiform bone develop at the level of you can say wrist joint, that is minimization of the friction, and third bone, that is fibula, that is at the level of you can say tibia and fibula. It also causes minimization of friction. This sesamoid bone, they are also important for alteration of the direction at the level of the joint. As for example, here you can see this action. Here you can see, so this alteration of the action that is helpful by presence of you can say patella bone at the level of knee joint. At the wrist joint, alteration of direction, that is adduction, that is also you can say alteration that is helpful by presence of pisiform bone. Last but not least, that is the function of sesamoid bone. So it causes maintenance of local circulation of the particular joint. As for example, presence of patella causes increased surface area of the knee joint, and that is important for maintenance of blood circulation. Like that pisiform, like that fibula bone, they also causes maintenance of blood circulation of that particular joints. Last category, according to their shape, they are you can say accessory bones. What is accessory bones? But they are not always present. As for example, sutural bone present in the skull, then cervical rib, lumbar rib, they are known as accessory variety of bone. Normally their importance in medico-legal practice, and sometimes they mistaken for fracture of particular bone.